Hello, my name is Steven. I live outside of Houston in a town called Dayton. Professionally, I'm in corporate training in digital media. I enjoy hunting and fishing or working in my garden. If I'm not outside doing that, you'll find me in my shop where I do various welding and carpentry projects. So I have polycythemia vera, and I'm excited to share my story with you. So my journey began around the summer of 2021. I noticed a swollen lymph node on my side of my neck, which was concerning. And then shortly thereafter, I started feeling a greater sense of fatigue and general body aches. I just didn't feel right. So I went to see my local GP. We did some tests to figure out what's going on and order some CAT scans. So it was a kind of a long limbo period where I really didn't know what was going on, so it was just a wait and see approach, which was very frustrating. I remember I was at lunch one afternoon and I got a call from this lady. I was like, "Who are you?" And she's like, "I'm so-and-so with Dr. So-and-so." I was like, "Who is Dr. So-and-so?" "Well, he's an oncologist." My heart dropped. You're like, why is a cancer doctor calling me? That's the moment your life changes. And that's when I heard, "You have PV." Like, what is PV? But then there was a slew of other acronyms. MPN, this, that, blah, 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 blah. I went home and went to Dr. Google. And just with a few acronym terms that I could recall, it wasn't a great experience. You can get some very scary things. The biggest thing I remember seeing, average lifespan of 6 to 8 years, which hit me like a ton of bricks. So initially, my first oncologist gave me hydroxyurea to treat my PV with no information about the drug. I was put off immediately when I found out it was a chemotherapy. I was already feeling pretty bad with PV, aches, the pain, the fatigue, and it wasn't controlling my numbers. Thankfully, I ran into a longtime family friend that I knew had headaches and similar symptoms that I had, and he said, "You're what? Go to the local cancer center. They have specialists there that know about MPNs." I just remember the first time the doctor came in and said, "Listen, let's get it out of the way. It is cancer, but don't worry about that. We have treatment options." And she went on to explain different treatment options with MPNs and her personal patient experience. So it was very comforting to know that, hey, I have options. So when I was talking to my specialist about treatment options, she told me about a recently approved drug called BESREMi. And it was an interferon, and she said, this one targets the bone marrow. So we're actually targeting the source of the issue. We had further conversations about how it worked, and then we decided BESREMi was a choice for me.
Important safety information. What is the most important information I should know about BESREMi? BESREMi can cause serious side effects that may cause death or may worsen certain serious diseases that you may already have. Tell your healthcare provider right away if you have any serious side effects during treatment with BESREMi. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking BESREMi. These symptoms may go away in some people after they stop taking BESREMi.
So then there was the next hurdle, how to get it. I was concerned about it, but she's like, "Don't worry. Our team will work with Pharma Essential Source to get the medicines for you." So starting BESREMi, I was a little skeptical given my prior experience with my diagnosis, but I was pleasantly surprised how well BESREMi controlled my counts. I was working with my doctor to understand the process of how the drug worked. In doing so, I came to understand that the max dose was the 500 micrograms. That was kind of my target. I wanted to do the max dose I could tolerate and get no phlebotomies and get my numbers under control. We discussed slowing down, but I'm a Southern boy, so I'm pretty hard-headed, and my goal was 500. And I achieved that goal. I stayed at that for about a year. Like I said, my counts were controlled, so I'm now happy to say that, hey, I'm on the other side. I'm going for a maintenance dose. Prior to my condition, I actually donated blood a lot, so I'm not really concerned about the needles, but when you hold it in your hand and now you got to stick yourself, it's a little different. And it's funny, interesting how, the first few doses, it took 15, 20 minutes. Now I can do it in 3 or 4 minutes. So starting BESREMi, my doctor was concerned about educating me about the side effects. The most common I did experience was flu-like symptoms. It was a greater in the beginning, but it wasn't bad. It was like I was getting the flu, not had the flu, and that's really subsided. I still feel a little icky a day or two after my shot. So since I've passed that year mark and I'm transitioning to my maintenance phase, I often get asked, how you describe your experience with BESREMi? Thinking back, in control, my counts are in control. I'm in control of this disease.
Important safety information continued. What is the most important information I should know about BESREMi? Continued. Mental health problems, including suicide. BESREMi may cause you to develop mood or behavior problems that may get worse during treatment with BESREMi or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, feeling bad about yourself or feeling hopeless, unusually grand ideas, acting aggressive, acting impulsively, or thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, you, your caregiver, or family member should call your healthcare provider immediately. Your healthcare provider should carefully monitor you during treatment with BESREMi. New or worsening autoimmune problems. BESREMi may cause autoimmune problems, a condition where the body's immune cells attack other cells or organs in the body, including thyroid problems, increased blood sugar, hyperglycemia, and type 1 diabetes. In some people who already have an autoimmune problem, it may get worse during your treatment with BESREMi. Tell your healthcare provider if you have tiredness, are urinating often, or if you are very thirsty. Heart problems. BESREMi may cause heart problems, including problems with your heart muscle, cardiomyopathy, heart attack, abnormal heart rhythm, atrial fibrillation, and decreased blood flow to your heart. You should not use BESREMi if you have high blood pressure that is not controlled, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, or a recent stroke or heart attack. If you have a heart problem before you start using BESREMi, your healthcare provider should monitor you closely during treatment with BESREMi. Who should not use BESREMi? Do not use BESREMi if you have or had severe mental health problems, especially severe depression, thoughts of suicide, or attempted suicide. Have or had a serious or untreated autoimmune disease. Have had a serious allergic reaction to another interferon product or to any of the ingredients in BESREMi. Symptoms of a serious allergic reaction may include itching, swelling of your face, tongue, throat, trouble breathing, feeling dizzy or faint, and chest pain. Have certain types of liver problems. Have received a transplant and take immunosuppressive medicines. Before using BESREMi, tell your healthcare provider about all of your medical conditions, including if you are being treated for a mental illness or had treatment in the past for any mental illness, including depression, and have had thoughts of hurting yourself or others. Have type 1 diabetes. Have or ever had any problems with your heart, including heart attack or high blood pressure. Have or ever had bleeding problems, a blood clot, or low blood cell counts. Have a condition that suppresses your immune system, such as certain cancers. Have hepatitis B or HIV infection. Have kidney or liver problems. Are pregnant or plan to become pregnant. BESREMi may harm your unborn baby and may cause loss of your pregnancy, miscarriage. Before you start using BESREMi, your healthcare provider should do a pregnancy test. You should use effective birth control during treatment and for at least 8 weeks after your final dose of BESREMi. Talk to your healthcare provider about birth control choices for you during treatment with BESREMi. BESREMi can affect your menstrual cycles and may cause your menstrual periods to stop. Tell your healthcare provider if you become pregnant during treatment with BESREMi. Are breastfeeding or plan to breastfeed. It is not known if BESREMi passes into your breast milk. You should not breastfeed during treatment and for 8 weeks after your final dose of BESREMi. What are the possible side effects of BESREMi? BESREMi can cause serious side effects including decreased blood cell counts. Your healthcare provider should check your blood cell counts before you start and during treatment with BESREMi. If your blood cell counts are too low, you can develop anemia, infections, or have problems with bleeding or bruising. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nose bleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions and skin reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, chest pain, or feeling faint. Eye problems. BESREMi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with BESREMi if you have diabetes or high blood pressure and also have retinal problems. Your healthcare provider may stop BESREMi if you develop new or worse eye problems during treatment with BESREMi. Liver problems. BESREMi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with BESREMi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with BESREMi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, blood in your urine, swelling in your ankles, or loss of appetite. Your healthcare provider may stop BESREMi if you develop severe kidney problems. Tooth and gum periodontal problems. BESREMi can cause tooth and gum problems, which can lead to tooth loss. BESREMi can also cause problems with dry mouth that can damage your teeth and the lining of the mouth during long-term treatment with BESREMi. It is important for you to brush your teeth well 2 times each day and have regular dental examinations during treatment with BESREMi. Skin problems. BESREMi can cause skin problems. Signs and symptoms of a skin problem with BESREMi include itching, hair loss, rash, redness, psoriasis, acne, thickening of the skin, or excessive sweating. Call your healthcare provider if you develop a rash that is bothersome or covers a large skin area. The most common side effects of BESREMi include flu-like symptoms including tiredness, weakness, fever, chills, muscle aches, and joint pain, itching, sore throat. What is BESREMi? BESREMi is a prescription medicine that is used to treat adults with polycythemia vera. Please see full prescribing information, including boxed warning and medication guide for BESREMi.